Hi everyone, thank you for tuning in to this video. And if no one watches this video, okay. This series is called Degradations in Canada, in the past and in the present. Things that might have occurred in the past that are definitely affecting the present. Who am I? I am a special ed teacher and I am also a qualifying psychotherapist. I have lived in the Middle East 14 years, 4 years in Emirates, 4 years in Egypt, and 5 in Qatar. So I've been immersed in other cultures, living in and around people that don't speak English. On the flip side, coming back to Canada, I live in an isolated Indigenous reserve, where maybe 6 of us, now 8 of us, come from outside to work on the reserve. Before, I was just doing working as a special education teacher the last 4 years, from nursery to grade 3. Now I'm doing that as well as qualifying as a psychotherapist from Yorkville University. So I work in individual, couple, group therapy. Right now I've been doing the individual, but hopefully soon I will be doing couple, families, and groups, because I just started in January. Anyway, I'm seeing lots of things going on in Canada. My own experience, my parents met in the Air Force in 1961, where my mother was given sodium pentothal, and the effects of that it had on our family and all 3 children, as she was pregnant with my brother at the time. There's a lot of racism in Canada. There's a lot of stigma in Canada, especially about mental health and who should be providing mental health for different populations. This is something I'm exploring currently in one of the presentations I'm doing about Middle Easterners coming to Canada, refugees, permanent residents, and the stigma around that, coming to Canada to start a new life, and how, because of the political system, maybe being a lawyer or doctor in their own country, or a specialist in a doctor, like a cancer doctor, coming to Canada and having to start all over again qualifying. So working as Uber drivers, and how mental health is affected by that. You gave up everything you had, everything, your family, your finances, your friends, the life you knew for years and years. Most of them have never left their country. They have come to Canada and started a new life. And what do they find? First of all, they have to go get English. And for some of them, they do speak English, but they might have to go back into a classroom for like a grade 2 English, because that's where the free English comes from. So how humiliating is that? You're a cancer doctor in another country, and suddenly now you have to pass these English requirements, which isn't so easy. And maybe you have masters in law, or you have PhD in something, and now you're thrown into, oh, you got to start with English. Okay, pass that if by any sheer luck. Of course, for those professions, they need a 9 or 10 in all areas: speaking, reading, and writing, listening, and speaking, reading, writing, listening, and reading. Not so easy when it's your second language. Now, maybe they go to the university, and here in Canada, lawyers do that. They go to International Laureate Path program at the U of A, but they don't give them a degree. So all they have is their transcript, making it much challenging to get a articling position. They have to do loops. The Bar Association, I do not understand. Canadian Bar, I cannot say it. I've looked into their guidelines, and if you look on their portal, you will see that they don't even have anybody like different nationalities. They're all pretty much white and men and women. They don't even have the different nationalities. How is that representing the people of Canada who come from different countries? Canada is multicultural now. It's not like when I grew up in the 60s. People come from many countries. Why? Because Canada has better opportunities, safety from their countries that are war-torn or under political regimes such as Egypt, where it's military dictatorship. There's no freedom of speech. You cannot go out in Egypt and say, I don't believe in the president. You can't say that, or you'll be arrested or killed. And that is not over-exaggerating it. That is the truth. I wonder how we can stand here as Canadians and not say something about all these terrible degradations that are happening. I hope in this series to examine different areas more closely and see how mental health is affected, and also see why we as Canadians don't care. Some do, but some don't. Some people think, oh, it doesn't matter about the other people, even the Indigenous, because they get money or they get whatever. Why don't we care about people? Are we so, like, yes, you have to take care of yourself, but there's also the act of being advocates for other people. And where is that in society? I don't see it. I also see reverse discrimination. There is reverse discrimination because of what happened in the past. Looking at a person who, caused that, their ancestry, because they're white or whatever, that's also occurring. But I wonder, why aren't we all taking more steps to ratify situations for people? People in the north can't even get a plane ride, for goodness sake, because the planes are always delayed and there's only one airline and you have to pay over $1,000 both ways. It's more expensive to go 1 hour than it is to go overseas. Why is that? And why is the planes not in good shape, but yet, they rebuild an airport? Why do people not care that when people go for medical appointments? Because there's no hospital in the north. Why is that people are put into motels or hotels that I wouldn't even put my dog at? And I can honestly say that because I stayed in one of them one time by accident, and I was horrified and basically tried to get out of there as soon as I can in the morning. It was dirty. It was even when they tried to clean again, it was dirty. It was unsafe. Someone's banging on my window at 3 a.m. Why does no one care about these things? Back in the day, I used to write to the letter to the editor about different controversial concepts, ideas, or events. And those were published a lot of times. But now I see people have become complacent unless it affects them directly. People in the city would never put up with the dirty water that we put up with here. They would never put up with having their water shut off for 3 days and losing all their food from electricity outages. That occurs a lot up north. They wouldn't put up with having 20 people in a house in Canada and their houses are falling apart due to lack of maintenance, or houses being burnt down due to electrical problems or people starting them. Where is it that we as Canadians, we take action and help people, not just by throwing money at them, but we see what the problems are and we try and make a difference, even if it's for one person by listening. I don't understand how our world is turning around. Politics, things are falling apart. Justin Trudeau resigned. Trump is doing all kinds of things. I don't understand any of that because I'm not political. But what I do know is people are not sharing they care about people. In fact, they're doing the opposite. Oh, these people take away from our society. They don't understand. Why should we all just be the same? Why can't they just embrace our country's attitudes and beliefs? And why should we have people come here and living in better houses than us, or getting options, or whatever it is? Look, guys, people are people wherever they're from. Everyone is the same. We all need certain needs: food, shelter, water, being loved, being heard, being seen. Going, yeah, I feel your pain. But not sympathy. How can taking more empathy, taking action, helping the person to take action if they need to? Where is that? Have we become so self-absorbed in society that we don't look past other people unless we're paid to do it? I wonder where the volunteerism is that used to exist in our society. I worry about poor health care for people up north where they're lucky if they get a good nurse because the nurses and doctors rotate. Sometimes they get amazing people, but they fly in and out, and sometimes you don't, just like any job. And babies die and people die because they were told at the nursing station or whatever, oh, just take them home, they'll be fine in a few days. And then you hear that baby died. Guys, it's not about me, it's not about you, it's about we. It's about we helping our society together. It's about taking steps as a society to help one another. I don't think if anyone does see this video, I will post it, but I hope that you will share it, and I hope that you will get some value out of it. We need to have a voice. Everyone needs a voice. Everyone. It doesn't matter your job, your nationality, your age. Everybody needs a voice. Let's be kind. Let's try and help one another and walk in this life together. Because it's a hard life and it's a short life. It goes fast. But try, even if you say hi to someone you don't know, or give a smile as you pass by. For someone, that might be something just to keep them alive. Thank you for listening, and please take what I said to heart and try and be in the present for other people. Family members, friends, people you don't know. Let's keep everybody safe. Okay? So let them be heard. Thank you.